Hello, my name is Nick Cohen. I'm a doctor and I'm here to share with you tips for children with type 2 diabetes. Tip number 1. For children with type 2 diabetes, take your medicine. Taking your medicine is important for managing your diabetes, whether you're taking oral medications like metformin or insulin, whether you're taking short-acting or long-acting insulin. Taking your medications is an essential part of controlling your diabetes. Tip number 2 is to maintain a healthy weight. A healthy weight in children is a BMI percent of 5 to 85%. To find out your BMI percentile, you can just go online and Google BMI for children. You'll need your height and your weight, and you'll get a result which will be the percentile of your BMI for your age. And this will help you determine whether or not you need to lose weight. If your BMI is greater than 85%, then you'll need to lose weight. And losing weight will be very helpful in controlling diabetes, because being overweight means that insulin is not easily used by your body, and so it's harder to control your sugar in your blood if you're overweight. Tip number 3 is to exercise an hour each day. So it doesn't matter if you do this all at once or if you do some in the morning, some in the afternoon, and it's best to incorporate exercise into your daily routine. So if you take a bus to school, then getting off, if it's a public bus, getting off the bus a few stops early would be a great way of getting more exercise by walking some of the way to work, to school, or being in on a sport team. It is important to get at least an hour of exercise every day. This will help you maintain a healthy body weight. Tip number 4 is 3 plates. 3 plates of food each day. That's a great way to control the amount of food you're eating. You can also supplement these 3 plates with 2 snacks, preferably just a fruit. Being a healthy body weight is very important when you have diabetes, and it's much easier to limit the amount of calories you take in if you're only eating at meal times and with 2 scheduled snacks. And when you think of your meal as just what fits on your plate, it's much easier to control the total number of calories than if you're grazing, like taking some food here, taking some food there. If you just sit down, have 1 plate 3 times a day, and then 2 snacks, each of them of fruit, then you'll have a lot easier time controlling the number of calories you eat. Tip number 5 is fruits and vegetables with every meal. So make sure whenever you sit down for a meal that you have fruits or vegetables. This is a great way, an easy way to meet a goal of at least 5 servings of fruits and vegetables each day. So you can put fruit on cereal, you can have a salad at lunch, and a serving of vegetables with dinner. Tip number 6 is no sugar. So anything with sugar should be avoided. So sugar is most commonly found in soda, like high fructose corn syrup. That's a refined sugar. Another refined sugar is candy or baked desserts. If it has refined sugar in it, avoid it. There's healthy ways of getting sugar like fruits, and the difference is that fruits have fiber and refined sugar does not have fiber. And when you have fiber that's mixed with sugar, then it takes your body time to break down, and it doesn't cause a real rise in your blood sugar. So try to avoid any pure, unrefined, or any refined sources of sugar, which is high fructose corn syrup and sugar added to candies and desserts. Tip number 7 is whole, not refined. So it's important to have whole grain foods, and because, as I said, this will make it your body will take a longer time to break down whole grain foods. If you're going to have bread, rye bread and pumpernickel bread are much better than white bread because they're harder for your body to break down into sugar, and so they don't cause a rapid rise in your blood sugar. And then other refined foods like cakes and desserts where you don't have a natural source of sugar should be avoided. Oatmeal is a good whole grain, and then if you can, avoid things like potatoes and rice because those are carbohydrates that are high in what's called glycemic index, which means that the sugar in them causes a high blood sugar, and that makes diabetes hard to control. So tip number 8 is eat grilled rather than fried meat. So fried meat, which contains saturated fat, is much worse for you than grilled meat. And when you have, the reason why people with diabetes should be careful about the kind of fat they get in is because diabetes can be associated with what's called the metabolic syndrome, where you have problems with your blood pressure, problems with your cholesterol, and problems with your diabetes. So to avoid the complications of the metabolic syndrome, it's important to avoid saturated fats, which are found in fried foods. And when you do have protein, it's much better to have chicken and fish because those are lean meats rather than red meat or pork. Because once again, there's much less saturated fat in chicken and fish. And in fish, there's a special unsaturated fat which protects your heart. Tip number 9 is recognize the signs of having a blood sugar that's too high and too low. If you do feel this way, then you should get help, either from a doctor, a school nurse, or your parents. So the signs of your blood sugar being too high are blurry vision and peeing a lot more and eating a lot more. The signs of blood sugar being too low are trembling, sweating, confusion. If you have any of these signs or symptoms, get help right away. And tip number 10 is believe in yourself. Starting at a young age, you can avoid most of the complications of diabetes. And this is a really important goal to have in life in order to live a happy and healthy life. So I hope these tips are helpful, and thank you for your time. Have a great day.